Hi, this is Dr. Kelley Mulhern with Thrive Wellness Center, and today we're going to be talking about the illness progression of COVID-19. This is something I get a lot of questions about in my practice on a daily basis, so I figured I would go ahead and put this information out there for other people to access. Now, one thing I want to point out is that our knowledge of coronavirus COVID-19 is changing. They call it emerging, but it is changing almost on a daily basis. So the information in this PowerPoint or in this presentation is accurate as of early May. Now, a little bit about me and my background. Dr. Kelley Mulhern, you can see kind of alphabet soup after my name. One of the first things I like to mention is that I have been a volunteer for the Foundation for Wellness Professionals for quite some time. What that means is that I donate my time to serve my community by helping to educate them on topics of health and wellness. So the Foundation for Wellness Professionals is dedicated and committed to helping communities and individuals understand more about health and wellness and their options. So I go out into the community and do health talks, etc., at no charge to promote health and wellness. I am by training a doctor of chiropractic, but I also have a master's degree in public health with a concentration in epidemiology. Now, what does that mean? That means that I spent almost 2 years after my doctoral degree gaining education and studying infectious diseases, epidemics, and pandemics. So that makes me a little bit more qualified than your average bear to talk to or speak about coronavirus, COVID, and other such issues. I'm currently enrolled in a postdoctoral certification in functional medicine. I'm a published author. So that's a little bit more about me, but one thing that's not on this slide that I wanted to mention as well is my mission. My mission is to help as many people as possible live lives that are happy, healthy, and free of drugs and surgery and pain as much as possible. So again, I help work towards that through my personal practice and my work with the Foundation for Wellness Professionals. So again, that's a little bit more about me. Let's dive right in. Now, one of the questions that I get very frequently over the last 2 months is concern or worry from people about being contagious before they even know that they themselves might be infected. And that is true, and that is a concern with a lot of viruses and bacteria, that you can be contagious before you start showing symptoms. So to kind of help with that, there's a few things that I recommend that my patients do. First is hydrogen peroxide gargles. Now, you probably have hydrogen peroxide in your bathroom closet, so I recommend that you go get it and take 2 capfuls or about a teaspoon and add that to a half a glass of warm water and gargle. If you're not having any discomfort, you can gargle once or twice a day, and that's all you need to do. And if you have any discomfort, that means it's working. It's attacking something. So that at that point, I would recommend doing it every 30 to 60 minutes until the discomfort is gone. Now, the reason for this is because oftentimes with these respiratory viruses, they gain entry into our body when we breathe. So we can inhale them in through our mouth, and they can take up root in our throat, or we can inhale them through our nose, and they can get engaged in the sinuses or mucous membranes. And doing the hydrogen peroxide gargles can help eliminate them before they become a problem. Next is supplementation, so boosting vitamin C intake, D3 intake, and zinc intake. Zinc is especially important in terms of the COVID-19 issue. Now, one caveat to this is that you need to work with somebody who is credentialed and skilled with supplementation. Don't try to do this on your own. There are certain contraindications for supplementation of varying vitamins and minerals that your average person might not be aware of, but also there are different grades of supplementation. Not all supplements are the same, so working with somebody who is skilled in this area can help you spend your money wisely and not needlessly throw it away on a supplement that's not high quality. Next is a nasal spray. Now, the nasal spray can be anything from a simple saline rinse all the way to like a Zicam or up through prescription. Now, the saline rinse is really more of a mechanical issue. It's mechanically flushing the pathogen, the bug, the virus, out of your sinuses or your nasal cavities, so it can't take hold. It just kind of rinses it through. Zicam uses things like zinc, echinacea, etc. to help and combat the virus. And then, of course, you can have prescription nasal sprays for allergies and things like that that can also help address an issue at its source. Now, obviously, we want to follow the guidelines, which kind of frustrating because it seems they're constantly changing, but just staying on top of those and following whatever the current recommendations are. Now, with face masks, it seems that everybody has an expert opinion on face masks, and half of the people say they're necessary, half of the people say they're not. So my best advice to my patients is do whatever makes them most comfortable, or not putting themselves in those situations in the first place to have to make those decisions. Now, there's 2 daily measurements that I recommend that people take every single day, sometimes a couple of times a day, to help monitor their health. First one, very simple, is temperature. Looking for spikes in temperature. Now, 98.6 has long been regarded as textbook normal for human body temperature, but most people run a little bit lower than that. It's not uncommon to see somebody at 97, 0.5, 97.2. So don't panic if it's lower, but you want to be watching to make sure it's not creeping up over, say, 100 degrees or so. The second measurement is to monitor the saturation of oxygen in your blood. It's very easy to do, and we're going to talk a little bit more about that later, why that's important and how you do it. And then a last little tidbit for somebody who's in that maybe pre-infection status would be to go to our website and watch the video that I did on over 50 tips to support your immune system. Not all things in there will apply to every person, but with over 50 tips, you're bound to find a couple of things that you can do to kind of take back some power over your health and make your body less hospitable to viruses and bacteria. Now, days 1 through 3, when somebody has been infected with the coronavirus, typically the symptoms are mild. So for the average person, they might notice a dry cough. They might notice that they're being more fatigued. Their temperature may start to rise. They may have a mild headache. The other thing that has come out in a small percentage of patients with COVID is a loss of their sense of smell and or taste. So again, that's not in all patients, and as the weeks have gone on, they have found kind of pockets of other symptoms that aren't expressed by everybody, but there are certain people that have certain other kind of manifestations, if you will. So some small subset of population of people with COVID may experience a rash or something like that. But we're just talking about kind of the general, what we know for the average person that is infected with COVID. So that's days 1 through 3, typically pretty mild. Days 4 through 8, we're going to see an increasing in intensity of those earlier symptoms. And around day 4 or 5, older patients and those patients with underlying health conditions, those chronic diseases, etc., should really start watching for signs of a more serious infection. So if they are having increasing in their shortness of breath, if their cough is changing, if their fever is worsening, those sorts of things, really keeping an eye out for those. Now, those underlying conditions, I will mention that early on we kind of assumed that the people most at risk for coronavirus issues or fatality would be those with underlying respiratory issues, COPD, emphysema, things like that. What we have seen over the last several months is not so much the respiratory complication, but more people that have underlying issues such as diabetes, insulin resistance, obesity. Those things are people that have those underlying issues are having a harder time with coronavirus, and those are the ones that wind up having the more aggressive course. Now, in the upper right-hand corner, you see that funny little gadget that doctors put on your fingertip. That is a pulse oximeter. So very simply said, it takes your pulse as it measures the oxygenation in your blood. And so you just put it on the fingertip and you give it a few seconds and it'll take a reading. I will mention that if you're really cold, it has a hard time taking the reading, or if you're wearing acrylic nails or dark nail polish, that can interfere with the reading as well. Now, in general, for your average healthy person, we would expect your oxygen saturation to be 97% or higher. If somebody, say, had, seasonal type of bronchitis, something like that, it might drop down to 94, 95. At that point, if they were in the hospital for that, they might be put on supplemental oxygen. But one of the interesting things is that in some small pockets of people that have the aggressive form of coronavirus and COVID, is that they will present to the doctor's office, obviously sick, but having a normal conversation, not looking like they're in distress, not gasping for air. And when they do the pulse oximetry, they're finding that the saturation of their blood in terms of oxygenation is as low as 80%. And that is a huge issue. So this is something that, again, it's very simple to monitor. Put the little gadget on your fingertip for, under a minute, look at the reading and make sure that you're not dropping too low. Now, everybody's different, so this is where knowing your body and learning your body can be really important. So what's normal for you might not be normal for somebody else, but that's something that is super easy to do to help kind of track your daily progress. Days 8 through 12, typically at this point, people with mild cases are starting to feel better, but we still urge caution at this stage because even as the recovery process is happening, some people will quickly take a turn for the worse. Now, the jury's out on why some people get sicker and others don't. And we've all heard a lot of different theories. Oh, it's a genetic defect. It's affecting something on the male chromosome. I've heard that it affects certain blood types more than other blood types. Men over women. All the theories are abounding, and right now we don't have the data to say exactly why that is. I suspect once we look back in hindsight, we're going to find that the people who have the more aggressive form of COVID or the more fatal form probably are suffering with some nutritional deficiencies, vitamin D3 being a key one, as well as comorbidities with things like obesity and insulin resistance or diabetes. But again, it's really too early in the process to say why this happens. We just know that it does. So, and we also seem to show, it seems to be more older people that are having the really aggressive form or that are dying from COVID. But that being said, I would not let down your guard. If you or somebody that you love has COVID, I would be tracking it diligently daily, taking your measurements, the measurements of those around you, and until the recovery is through, I would not take anything for granted, just for your own well-being and peace of mind. Now, moving forward, if the person's illness was relatively mild, after, say, day 14, they should be pretty well recovered. Those whose symptoms were worse, but who had normal blood oxygen levels, should also start to be feeling better, although they may have, another week or two before they start really rebounding. Those who had severe symptoms or required medical intervention obviously are going to recover more slowly. It's going to take more time. Now, this is a diagram that I put together to help the visual people among us to kind of really think about the progression of COVID. So all the way to the left in the blue box is the date of exposure, whatever date that was. Moving forward, 2 to 21 days from that date of exposure, you can be shedding the virus. So you can be contagious during that period. At some point in that 2 to 21 days, depending on the person, is when they will start to manifest symptoms. Now, I wanted to talk just a tiny bit about testing, but that will be a topic for another presentation. There's been a lot of talk about testing, and right now we do not have good testing that has been really tested. The tests themselves have not been tested to make sure that they're highly accurate, number one, and number two, not highly available. But in short, the molecular testing is looking for the virus, and there can be problems with this testing if the person has a low exposure, they have a low burden of viruses, if the sample is not taken properly, or if it's really early in the infection. There's about a 30% false negative rate with the molecular testing. So that means 30% of the time you're told you're negative when in fact you are positive. Later on, after the symptoms have been manifesting 7 to 21 days, that's when we can start looking for antibodies. But again, everybody's different in terms of when they will produce them and how much they will produce. but the serology testing can be done at a minimum of 7 days post symptoms. And looking for different antibodies at different time frames. And again, really kind of getting into those details is a topic for another presentation. After your symptoms start, you're going to feel sickness for typically 7 to 10 days. Again, it's a virus. Most viruses, 7 to 10 days. Some people go 14 days. Some people we've seen 6 weeks that have more complicated cases. But again, we're kind of speaking to the average right now. So let's say 7 to 10 days. And then the recovery period, and as you recover, you might have another 3 to 14 days where you're feeling still not quite yourself. But after that, let's say the maximum 2 weeks of recovery, that's when your contagious period ends. The viral shedding ends. Now, for up to another week after that, you can still be shedding kind of snippets of the viral RNA, but that is not typically recognized as being contagious like the actual whole virus is. So that just gives you kind of an overview of the progression. Now here's my contact information. More than happy to answer questions or help people in any way that I can. You can choose to send me an email at drkelly@thrivewellcenter.com. And just a note about that, you'll see that Kelley is my first name, and I spell it with an EY at the end. So if you send me an email to Dr. Kelley and you forget that second E, you won't get a response. So if that's the case, just double check that you spelled my name properly. The office phone number is there, as well as our website, where we try to have more information out there for you. But again, I encourage you, if you have questions, if there's any way that I can help or be of assistance, especially to those in the greater Tampa Bay area, please feel free to reach out. And I wish that everybody stays safe and healthy, and protect yourselves and your family. And again, don't hesitate to reach out if we can be of assistance at Thrive Wellness Center. Again, Dr. Kelley Mulhern, hoping you all stay safe and healthy. Thank you.